material, there is a new content. So again, good evening, ladies and gentlemen, good evening, dear colleagues, good evening, dear teachers. I'm very proud, I'm very happy that I'm lecturing here in front of my teachers before my colleagues. So here I'm going to present one of my favorite types of lecturing, which is a direct posterior but in the videography way. It has a lot of videos after we pass the half of our presentation. So I'm a partner and a full-time job dentist in Lake TV Clinic since 2019. I'm also a Zoomax official microscope since 2 years. For me, for my humble opinion, the future is all about digital, it's all about magnification. So sooner or later, you will have to buy a microscope or loupe at least, because it's not fair game. لعبة غير عادلة بين الشخص اللي يستخدم تكبير والشخص that works by naked eye اللي يشتغل بعين. So digital and magnification is the future for dentistry. And also I'm a silver member since 2021. شوفون سنة 21 بالنسبة لي it was a year of a great achievement and we are still going on about this. So, before going to the entrance of my lecture, I will tell you just a funny story. كنت قبل فترة عندي واحد من الأصدقاء أحمد فريخ, he's a close friend of mine. أحمد فريخ يحضر دائما كورساتي, and he was telling me, and he knows my passion, my interest about posterior, mainly about contact area. Because this is the main function of everything, it's the point of health restoration that we give to the patient. فكان يحكي وياي, كان يقول لي حسن أنت مختار موضوع جدا مهم. قلت له what do you think about it؟ كان يقول لي بعيدا عن الأسنان, بعيدا عن كل شيء, حياة كلها it's about contact. Everything. There's this sort of cups, 2 cups, touching. قال إذا مو function contact, one of them will spill, right؟ قلت له صح. قال لي everyone will grasp his friend hand and everything will be normal. You're sitting in the chair, قعدتك على الكرسي أنت. If it's not in the correct position, it's not going to be comfortable to you. The same thing, my walk on the stage, my grasp to this one. Everything is about making it functional, healthy contact. So what about the teeth? What will happen to the teeth? The teeth. The same thing, the same story. If it's not healthy, functional, like everything in life, it's not going to be durable restorations. So the same thing, okay? So the main point is about giving a healthy, functional, durable restoration. And the main soul of it, of course, is the contact area. Healthy from the point of close contact, healthy one, doesn't allow to stagnate, and also smooth for a durable restoration. So to talk about a healthy, the first question I would ask for each lecture I would give, because المحاضرات دائما أسأل نفس السؤال, what do you think that you need to achieve a good contact area? Which thing that you will come to mind firstly? The first thing you will come to mind, or the first answer I will give always, good band, good rain, good witch. The same answer I get. But I'm always sharing my humble opinion about it. I'm telling them it's not about the matrix system, it's about the cavity first. Think about the cavity. فكر بالكavity. الكavity انت شلون تسويها؟ Design your cavity properly. Open the contact, and you're going to ask me, should I always open the contact? I'm going to answer you later. But design your cavity properly so everything will be easy for the matrix system. Don't think about the bands. Think about the cavity first, then you go to the matrix system. If you achieve a good contact, a good cavity with open space, you will provide enough space to your band to give you a new proximal profile. The breaking point here, the difference between proximal posterior restoration and the interior. With interior, yeah, it's logical to spend a lot of time to make texture, to make shades, to make everything smooth. I know, it's very mandatory, because we agree that nature is the most beautiful thing that we can get. But دائما انت تحاول من تشتغل interior, you try to reach the ultimate naturality. بالنسبة للposterior, if it is natural, we know it's God creation. But after all, the caries, it's a normal physiology that happens inside the mouth. Even if you don't have filling, at least you're going to have incipient caries. So it's a normal physiology, just like aging, just like you lose your hair, just like the skin. Everything is physiology. So you will have caries sooner or later. So in the proximal restorations, that's what's happening. The proximal caries, I know it's a naturally happening caries. So if you want to restore in the posterior area, you will think, oh, I want to make it natural. No, it's not like this. In the posterior region, we want to create something healthier than the natural. Because naturally, it's happening because there is a natural morphology in the proximal. So we want to make it broad, we want to make it healthy. So the question is, should I always open the contact? Yes, you should always open the contact to provide enough space for the band حتى يعطيك proximal profile جديد, broader and healthier than the natural, because now nature will already cause caries in all situations. It's something totally different from the anterior region. So provide enough space, you'll have a good contact area at the end. This is fundamental. This is fundamental for each proximal restoration. So after achieving a good carie design, then you will think about the banding system. The banding system is the second thing, it's not the first thing. Okay, so you know your band, you know your system, you know what you have, then you can know, either you can apply it properly and you can get a healthy contact at the end. So ABCs for each band, you have a height, yes, it's very mandatory. تعرف الهايت الباند مالتك راح يعطيك الهايت مالت الكونتاكت area, and it's always should be as a junction between the occlusal and the middle third. فإذا كان الباند عالي, yes, it's going to be the high occlusal contact, and at that point it's an open contact. بعد الكونتاكت انت تشوفها occlusal is closing and it's clicking. I know, direct or indirect restoration, the same story. But if it's not in the correct position, إذا ما كانت في المكان الصح, from the depth, not only from the wet area, that means it's an open contact. In the future, you will see that the food will stagnate naturally. So always pick the correct height for your band. The second thing is the curvature. It's very important to know the curve of each band. Each band has a specific curve, and this curve will locate the contact area. If this band is flat, and you're going to use it in an appropriate way, it's going to give you also an occlusal contact, which means it's an open contact. فاللفظ الcontact مهم جدا مثل ما ان الcontact closed or open. It's the same story. But the open is naturally, it's not occlusally. So the curvature, it depends on the what? On the size of the box, you should pick it. If this box is small, you need a narrow or slight curved band. If this box is medium, which is the normal scenario, you're going to need a medium curved band. And if this box is wide, you're going to need a highly curved band, or sometimes you do it 2 steps. This is for the curvature. So the third thing, which is the thickness. Each band has a specific thickness, and it's mandatory to know the thickness of your band that you are using. Because if your band is very thick, you have to provide maximum separation. أقوى قوة فصل ممكن لازم نسلطها وين؟ على الأسنان to have separation. حتى تحصل فصل enough إن الأسنان ترجع مكانها ولا ما ترفع المانتيك system. So from the point of thickness, the only thing that you should pay attention to is the 75 micron, which is the BioClear band. If تستخدم BioClear band, there's a special recipes for this one. I will share it with you in video before just pictures. Okay? So the last thing is the flexibility of the band. The question is there any relation between the thickness of the band and the flexibility? Logically, you will say yes. Thick band, it means hard band. No, it's not about this also. It depends on the material that's being manufactured with. ممكن يكون الباند تخين جدا 75 مايكرون يكون flexible, وممكن يكون 35 micron, and it can be very hard. You will ask, okay, which one should I use? Normally we will always favor the hard one. Not the thick, the hard one. Why? Because it resists deformation while you push it, especially in the deep cases. While we use the flexible if you have like cases like with negative cervical area. Otherwise, always go for the hard. So I mentioned like if you have a thick band, you need a separator, and the separator which are the rings. So you need to distinguish between the active rings and the passive ring. The passive that doesn't cause separation, like these clips. مثل هاي الكليبس اللي تجي ويا السدل والى اخره standardized clips. بينما الاكتف رينج the rings that cause forces اللي تسلط ضرر على اسنان تسوي لك separation بيناتهم, we call it active. You have a contact area, always use active ring. Do not go with a passive because you need this separation at the end. So I spoke about BioClear, and which is the thickest matrix, 75 micron. It's a heavy gauge one. I know, but so you need the maximum separation. أعلى separation ممكن توفره لازم ويا باندات BioClear. And how much it is, how you should like give this. Either to use like wedges, wooden wedge, with some Teflon, sometimes different Teflon to give it more volume. And the rings are rings for premolars. تستخدم رنجات للبريمولر حتى على المولر to give more separative force. And also you can have like another scenario, which is to apply idiot separator, a heavy metal separator. In that way, you will guarantee what? You will guarantee you will not have an open contact بسبب thickness mathematics. فلذلك maximum separation is needed. To share a video, the first video is music showing me. So apply the matrix. You see the matrix. The first wedge was deforming the band, and after that, I rechange it to wooden wedge, like modify it as not to deform the band. Sometimes the band can deform by the height of the wedge. So a little modification, then I'll push it, press it very hardly. It got broken, but it's enough sealed, it's a good separation. So for me, then I apply the ring. It's a BioClear ring, so I would use a ring for premolars at the maximum separation I need. رنجات transparent mostly انه بيها deformation عالي فتنسحب عن السن نفسه. So you need a push-pull technique. The contract flowable, push it from the middle toward the adjacent tooth, cure the flowable, we call it push-pull, then you hold the band in itself without deformation. And each transparent band possibly will need it. So you can see the contact area at the end. So it's all about how to push the transparent band here. Again, you finish your contact area, you need to replace the core of the dentin. So in these cases like this, if you have lost a lot of dentin, you should replace it with what? You should replace it with a material that's similar to the characteristic of the dentin, which is superficial, middle, and the deep. The deep cavities, yes, we always should use a flowable as our liner after the bone, of course. Then you cure it, then you apply a fibrous material, which is as mentioned in many articles, okay, which is the FRX, the short reinforced fibrous composite. It has almost the same characteristic of the deep dentin. So if you have lost a lot of deep dentin, you need to use a material that should have the same characteristic. And also, we know that FRX is a bulkful material, which mentioned to be like can be cured by 5 millimeters. But again, the literature says something else. It tells us do not bulkful the bulk. معنى حتى البلكفul اللي نقدر نكيرها 4 ملم 5 ملم تستخدمها as bulkful. To have a lower stress as possible, go as a normal composite, even though it's a bulkful. So this is the fibrous material. After building the wall, then here I'm just replacing the dentin with FRX material. Cure it, and then you can seal it with a packable from outside, and that's it. So be smart when you replace your dentin. Pick the right material, but apply it also very smartly. Do not bulkful the bulkful. This is the point from this video. Again, you finish the core. Okay, let's go to the modeling. So you have two ways, which is the old traditional one, which is the layering, and you have what? You have the FMT as mentioned by Hassan in 2021. The one and the left layering, we cast by cast, each composite is being packed, modeled, and we are using the file, and the one on your right side of the screen is FMT or espresso. I'm using just file to make the deep cuts. Each cut should be very deep. It has to be very deep. Each layer has to be very separated from each other. And in a kayak as a one mass, you're going to have a high C factor, area of shrinkage will affect more on the place. At that point, you will have what's a high stress. So each layer should be separated from the other. Here, each layer is condensed by itself, modeled by itself. ممكن تنزلها كم نفس شيء بالفايل, but at the end you cure each layer on the area. You see it's a normal speed بالنسبة للفيديو مالت FMT. بالنسبة للlayering technique, I'm speeding up to make it look shorter. It takes a lot of time, I know. This one is shorter time, but it needs a little bit practice on the FMT. It looks very simple at the beginning, but you have to practice a lot to nail it. So just to make shortcuts in your daily practice. I know posterior restoration is a very stressful procedure. Patient ما يقدر اللي يشتغل عليه. الأخير he doesn't care. As long as it is healthy, without pain, it's going to be more than perfect for him. He doesn't care about morphology, but we do it like for daily practice to make like some passion in your practice. نهاية اليوم أنت you feel exhausted, at least when you شوف شغلك بنهاية اليوم you will feel more passionate. So you make these fissures. You make the cuts. You cut for the FMT or the layering. Okay, you make grooves. And we know also that composite, it's a plastic material, it's not completely healthy like enamel. So each fissure, each undercut you have made, you have to make it smooth again. So each fissure, كل fissure أنت تسوي, you have to seal it again. So use a dental stains, which is a flowable material, flowable composite, but with stains. If the patient rejects the tints, which means like, على الأغلب يسألك I want a white composite, then you do not use a dental stain, but you have to seal the fissures. No fissure should be left for another visit. Like this, after the cutting of FMT, we have a very deep grooves, you have to seal it. It's not logical to leave it open because it's retentive. So, you have two techniques to apply your dental tint. First of all, if you are doing this FMT, we are doing it with deep cuts, it means this cuts has to be filled with your material, dental tint, or flowable, or whatever it is. So in this technique, we inject. It's mandatory to inject. You have to inject everything inside. فحتى يضغط لك كل الهواء, كل الاir to push it away. ونستخدم file just to make sure that we don't have any gaps inside the fissures. Then after that, you add whatever tint you want. The first tint is a trans tint or ochre, برتقالي أو شفاف. The tint الثاني, you can use whatever color that you want, dark brown, black, whatever it is. But after all, take the patient approval about it. Some patients reject the dental tint, okay? So some microbrush to remove the excess. In the chancery grooves, deep enough, you will see it's retained. راح تحافظ على كل التنت بداخلها. Brush it as much as you like. See, this is the view that I had. No grooves are exposed. Everything is filled. Everything is almost smooth, but still not a finished case. Still not a finished case. Now, لحد وصلت, okay, I finished my restoration, but I didn't polish it and correct every irregularity that I had. Now, composite is still viscous, it's still not completely cured because of the presence of oxygen inhibited layer. فالبيشنت قبل لا يغادر أكيد you have to close the chain, the chemical change. الحلقة الكيميائية you have to close it. Because after all, we mentioned composite is not healthy material unless it's highly polished and it needs maintenance after all. You have to close the chain by either curing through blistering the new polish, or you use a profilum polish, or heavy polish. All that. But after all, we will share it in the next slide. Another way to apply tint. إذا اشتغلت layering مو FMT, sometimes you don't have a deep grooves, very shallow grooves. فممكن تروح شوي delicate أكثر. Yes, no need to inject a lot of material. ما راح تحتاج تدخل كميات كبيرة من الماتيريال. You can use any sharp instrument. أي instrument حادة عندك بالغالب تستخدمها. Just apply the tint, okay? Apply it very delicately, don't make a chaos, and you can see the fissures are fine, very narrow, so the tint will follow the grooves. That's what will happen. That's the normal scenario. Then again, another micro brush to remove the excess. هنشيل الزايد كله. تمام؟ هتشوف انه it's retained. يبقى الاكسس يبقى داخل الجروف as long as a good groove, good smooth one. The same, it's not a complete case. It needs what? It needs finishing and polishing. So polishing, the last step for each restoration. Usually I start with this slide, but in this slide I promise that it has a lot of videos. So for each technique I'm going to show a video. You have 4 steps polishing if your composite is not completely smooth. 4 steps. You can go Eve, red, white, then go to hairbrushes, then Prisma gloss with a polishing paste, or you can go 2 steps Georgia, which is my favorite for everyday practice, or you can go 1 step. But the only secret is about 1 step, and the 2 steps, you have to model your composite. Composite, it has to be smooth, very delicate. So when you take a look at it, you will see like it's almost polished. تقريبا هي مبولشة. But you have to polish it after all. You have to remove all the micro irregularities and you have to remove the oxygen layer. فلذلك هنشوف أول فيديو تشوفون الفرق بين الصورتين. It's only polishing to remove the oxygen layer and to have a very smooth surface resistance to the dental black. So the first video for the polishing, it's a 4-step. You can see here. The first pair is Eve, the red Eve. The red Eve it cuts a lot. بتستخدمها بسلايد برشر. بعدها جوتا, the red jota, it's a very delicate pair, do not cut a lot, it's only polishers. Then the white jota with a lot of water, with excess of water. Okay, we're gonna make a question about should we go dry or we should go wet. there's a big difference in that. In the literature, there's no significant difference between the dry or wet polishing. But the only thing that I'm going wet just to have a clean restoration away from the remnant. And scenario المعتاد دكتور when I finish my restoration and took عندي depressed sticky بالروز. Yes, avoid it by going with what? By wet polishing. Do not go dry. This is the point. But significantly, there's no significant difference because composite, after all, there's no thermal conductivity in it. So don't be afraid. As long as you have a good cavity, good adhesion, you will not have any problem with dry polishing after all. Okay? And especially for the anterior segments, we would prefer and highly recommend it to go dry. Because in the anterior segment, it's better to polish dry to see what you are removing and what you are polishing. So another case here is the two steps. The same thing, just the red and the white jota with a lot of water also. See? The same thing, the same story. Just a lot of water in every step to have a good polished surface without any depress. You see the difference between the two pictures? Just 2 to 5 minutes, no maximum. It's all about to go wet and make well-adapted composites. And you see the jota even can polish the amalgam, by the way. So even the amalgam can give you a high luster, shiny appearance when you polish it in jota. The last thing, we love like to make shortcuts. I know it's a stressful day. I want to make it as short as possible for the patient, for me, for my secretary, for everything. So I would love to take more shortcuts. The last video is about one-step polishing. The one-step polishing is like this. Before polishing, it's filled with resin, upper-active resin, which is the oxygen-inhibited layer. It's upper-active composite. In this video, the last clinical video, you can see prophy powder to remove the oxygen-inhibited layer, and you will get rid of the stickiness. You will have a chalky appearance. وكأنما مكير through the glycerin. بعدها just white jota, no more. Just white jota with a lot of water again to get rid of the difference. You see, you can go 4 steps, you can go 2 steps, or you can go 1 step. And this is the final result. It's only 1 step. Take time in adaptation, but in the final result, you will have what a very short time. This is after coffee, very chalky appearance, and this is what after polishing. It's more than enough, it's more than perfect for me and for my patient. I don't spend a lot of time in polishing as long as I'm spending a good reasonable time in what? In adaptation. And this is the final result.